unit with burns. So, burns, this is an in which a transfer of energy from a heat source to the human body results in tissue loss, damage, or irreversible destruction. This can be a thermal burn, chemical burn, electrical burn, or even radiation burn. Burns are categorized in 3 different ways. You've heard first degree, second degree, third degree. Well, this is kind of the same thing. Superficial is going to be your first degree, second degree, and full thickness are going to be your third degree. So superficial burn, this only involves that top epidermal layer. Think of a sunburn. A mild sunburn is going to be a superficial burn. Usually can be treated with analgesics or ointments. This typically is, if somebody is really badly sunburned, they're also probably really dehydrated. So we want to push fluids. They may have headaches. They may have chills because they're losing a lot of body heat through this burn, things like that. Partial thickness, superficial or deep, depending on the depth of the burn. What is different about superficial and partial thickness is going to be blisters. Blisters are going to be seen with the partial thickness. It gets down into the entire dermal layer, so it's beyond that first layer. This is usually a flash burn with contact with something hot. A bright red and moist glistening appearance with a blister formation usually occurs. Pain in response to air is going to be severe. Pigment changes are often common with this type of a burn. Treatment, again, analgesics. They may need some kind of grafting depending on how extensive it is, which can be biologic or synthetic. And if it's down to the hair follicles with this type of burn, it will have a pale and waxy, moist to dry appearance with large blisters. Capillary refill can be decreased depending on it, if it's by an extremity. Sensation to deep pressure is going to still be present. This is going to be less painful than superficial. We have a risk for necrosis, for some pretty severe scarring and functional impairment of the skin. Treatments may also include excision and grafting, so they may have to cut some of the dead tissue away. And then analgesics, of course, for pain management. Full thickness burns, so these are the third degree burns. These are the most severe. These involve all the layers of the skin and could be down through subcutaneous tissue, muscle tissue, and even down to the bone. This is due to prolonged contact with something hot. Pale, waxy, yellow, brown, mottled, charred, non-blanching red skin is going to be seen. It can be dry, leathery, and firm to the touch. Pain and touch receptors are destroyed. So in the wound bed itself, they may not have pain because those pain receptors are destroyed, but like the wound edges, they may have significant pain yet. Treatment is going to be grafting, and then lots of pain management. Things that we also worry about, I'll get to it in the next slide, I guess, or in the next couple of slides. So here's a picture of superficial, the partial thickness, which has blistering to it, and full thickness, which can be like crater-like, that brown leathery, that kind of thing. All right, the rule of 9. So how do we do an estimate of burns? How much of the body is burned? We have the rule of 9s. So we get 9% for the entire head, 9% for anterior chest, 9% for posterior chest, 9% for lower back, 9% for abdomen, 9% for the front of one leg, 9% for the front of the other leg, 9% of posterior one leg, 9% for another posterior one leg. Groin only gets 1%, and then it's 9% for the arm, for the entire arm, 4.5 for anterior versus posterior. Same with the other arm. So this is how we can do a quick estimate of how much of the percent of the body is burned. So there's a lot of different elements. Burns can be very, very complex in how we treat them and how we manage them. So we have a high risk for infection, especially if we have a second to third degree burn. So we look at, there's a disruption of the skin integrity. The skin has jobs. Okay, and some of the job is to keep the insides inside, right, including fluids, and to keep bad things from getting in. Well, if you have a disruption in skin integrity, it just can't do that. So all cares must be sterile, because or like, you know, if we're going to be doing any kind of wound management, wound care, they need to be sterile. You have to touch these with sterile gloves. They are at high risk for hypovolemia, edema, and electrolyte imbalance. The skin can no longer hold in the fluid. And so we can especially see that with the second-degree burn, with that blistering, that's fluid escaping because the function of the skin has been impaired. Damaged capillaries cause intravascular fluid to leak into the interstitial spaces. So we're going to see edema with that. And then also, you know, if we don't have fluid in the vascular bed, we're going to be at higher risk for hypovolemia. Risk for hypothermia because the skin can no longer assist in containing heat and containing that body heat. Nutrition, we need to amp up protein in order to help rebuild tissues. Debridement is the process of removing dead tissue from a wound. So this is kind of the purpose of wound packing. When we go to pack wounds, you know, and we've done that with the wet to dry dressing, it's so that when we take those dressings out of that wound, that we're taking dead tissue along with it. So hopefully we get some bleeding skin, because that shows us that that skin's alive underneath, or that wound tissue is alive underneath. Eschar is a hard crust that forms over a burn wound. So this is a very, very tough skin that can form. And while the problem with this is it doesn't allow the tissues to expand like normal, so then you have problems with perfusion and edema building up and not allowing blood to actually circulate to the feet or to the arms or wherever it needs to. So an escharotomy might need to be performed, where that's what this picture is. They have lanced through the eschar tissue in order to open that up and let those tissues get perfusion. So that can be very painful, obviously, for a person. So that is the end of Unit 3.